Vitamin D, also known as the sunshine vitamin, is a fat-soluble vitamin that plays a crucial role in various bodily functions. It is essential for bone health, immune system function, and overall well-being. However, recent research has highlighted its potential impact on mental health. Vitamin D was first discovered in the early 20th century when scientists were investigating ways to prevent rickets, a bone disease caused by vitamin D deficiency. The fortification of milk with vitamin D in the 1930s significantly improved the situation and helped eradicate rickets. Since then, researchers have continued to explore its effects beyond bone health. Vitamin D receptors are present in various tissues throughout the body, including muscles, the heart, brain, and immune system. When exposed to sunlight or obtained from dietary sources, vitamin D is converted into an active hormone. This hormone assists in calcium absorption and regulates other essential processes. Several mental health disorders have been associated with low vitamin D levels. One obsessive-compulsive disorder, OCD. Research indicates that individuals with OCD tend to have significantly lower levels of vitamins D and B12. These deficiencies correlate with symptom severity. 2. Attention deficit hyperactivity disorder, ADHD. Although evidence is mixed, some studies suggest that children with ADHD may have lower vitamin D levels. 2. Treating deficiency in this population remains important. 3. Schizophrenia. Observations show that more people with schizophrenia are born during winter and spring months when sunlight exposure is limited. Vitamin D deficiency during infancy has been linked to an increased risk of schizophrenia later in life. 4. Depression and anxiety. Vitamin D supplementation has shown promise in improving symptoms of depression and anxiety. Researchers believe it may restore balance between neurotransmitters GABA, calming, and glutamate, excitatory. The recommended daily intake of vitamin D varies by age group and individual needs. Generally, adults should aim for around 600-800 IU, international units per day. However, consult with a healthcare provider to determine the appropriate dosage based on your specific circumstances. While vitamin D is generally safe when taken within recommended limits, excessive supplementation can lead to toxicity. Symptoms of vitamin D toxicity include nausea, vomiting, weakness, and kidney stones. Individuals with certain medical conditions, e.g. hypercalcemia, or those taking specific medications should be cautious about supplementing without professional guidance. Positives, pros include 1. Supports bone health. 2. Enhances immune function. 3. May improve mood and mental well-being. Negatives, cons include 1. Risk of toxicity if overused. 2. Limited food sources, fatty fish, fortified foods. 3. Sun exposure varies by location and season. In conclusion, vitamin D is a vital nutrient that affects many aspects of our health, including our mental well-being. While the exact mechanisms and benefits of vitamin D for mental health disorders are still being investigated, there is evidence that it may help with conditions such as OCD, ADHD, schizophrenia, depression, and anxiety. Therefore, it is important to ensure adequate vitamin D intake through sunlight exposure or supplementation, especially for those who are at risk of deficiency or have mental health issues. By doing so, we can support our overall health and happiness.